Good afternoon and welcome to the third series of our ongoing webinar organized by the Pacific Group. I am Dr. Bhaskar and I'm representing Pacific. For our guests dialing in for the first time, a very brief introduction about the Pacific Group. Pacific is a pan-Asian organization headquartered in Singapore with operations in the Philippines and India. In India, we're located in Salt Lake, Kolkata, and are known as Pacific Oncology Multi-Specialty Polyclinic, or POP. POP is a one-stop shop providing expert consultations by renowned specialists. More details can be obtained by visiting our website at www.pacific.in or from our Facebook and Instagram pages. In the previous webinars, we discussed at length regarding diabetes and gynecological issues and COVID-19 infection. Today, we are going to touch upon a very interesting topic, COVID-19 and mental health. May 2021 was the Mental Health Awareness Month, and some of you may have heard many famous personalities around the globe talk openly about their personal battles in dealing with issues such as depression, anxiety, and panic. April and May 2021 was also a terrible time for India. The second wave was at its peak and claimed many lives, both young and old. Scarcity of oxygen and certain medicines led to widespread panic. Several people who were seriously ill with COVID-19 and hospitalized had a grueling time. Fear, worry, and stress are normal responses to perceived or real threats, and at times when we are faced with uncertainty or the unknown. So it's normal and understandable that people are experiencing fear in the context of the COVID-19 pandemic. Added to the fear of contracting the virus in a pandemic such as COVID-19 are the significant changes to our daily lives as our movements are restricted in support of efforts to contain and slow down the spread of the virus. Faced with new realities such as working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues, it is important that we look after our mental as well as our physical health. With us on the panel, we have Dr. Bhargavi Chatterjee-Bhattacharya, renowned psychiatrist, who will share her insights with us on the impact COVID-19 has made on the mental health of survivors and the community as a whole. Dr. Chatterjee's presentation is divided in two parts. The first part will detail general psychological aspects of the pandemic and mental health. The second part will be focused on clinical management. The session will be moderated by me and Lieutenant Colonel Dr. Shomnath Kundu. We are very thankful to Dr. Chatterjee for giving her valuable time for this very special webinar. Over to you, Dr. Chatterjee.
So let's start. Today, I'll be talking to you about mental health and coronavirus. Firstly, to give an outline of my lecture, as I said, the first part will be the framework, concepts and resources. And the next part will focus on management, before COVID, during COVID, and after COVID. This is at an individual level after the infection. So right now, things seem a little bit blurry like this. And let's see if we can add some meaning to it. Now, the traditional framework is you have a disease, you treat it, and the person gets well. Now, this traditional belief has all been challenged by mental health illnesses because some of the problems, for example, alcohol use, heroin use, any substance use is a lifestyle disease like diabetes, hypertension, etc., where you have to continue lifelong treatment. People come and ask us that when can we stop medication? They find it very difficult to accept that this is an ongoing process, this is a lifelong process. But whatever it is, the usual framework is not helping us to conceptualize the COVID crisis. And so we need a novel framework to conceptualize the problem. The problem is we don't have a model. We have heard about it in storybooks. We have read about it in storybooks that there were cholera, there was influenza, and that wiped out villages after villages after villages. But we don't have any practical idea of what it was like and why it killed so many people and what was it like. And the resources, obviously, the resources are very stretched. So let's hope that under the lots of people have connected to pets. during this COVID crisis. In fact, one of my patients, they have adopted a daughter, and that has helped them cope with the crisis. Many people have connected with nature, with art, and that has helped them cope as well. Now, let's reflect what this is so that hopefully we can find some meaning and navigate the crisis. Now, first, it has tested our endurance. It has been protracted, going on for months and now years, and it has tested our capacity. The healthcare system has collapsed, be it in India, be it in abroad. But I mean, obviously, the healthcare has been stretched and it has collapsed. Now, almost everybody I know has lost either a friend or a relative or a close family member. And it's very, very difficult to come to terms with that. And one of our main focus is to find meaning, because when we reflect on the past, we try to make sense of it. That is finding meaning. And hopefully, if we can shift the narrative slightly, that might enable us to cope better. Now, loss and grief, they are not the same thing. For example, loss can be death, and grief is the reaction to it. And it can be intense, it can be confusing. For example, a person may feel relieved because a loved one had died. A person may grieve when a difficult relationship has ended. So it can be intense, it can be confusing. It's very difficult to make sense of this loss. And some people who have all, I mean, from the upper strata of the society, people who had finances, people who had resources, suddenly has seen that money, I mean, specifically, it was a major problem in Delhi, which suffered very much due to the second wave. People felt that their resources are of no use. They cannot procure hospital beds, they cannot procure oxygen, and for them to see their close ones die because of lack of oxygen, it had been very, very traumatic. So for them to integrate this into their life and move on is a monumental challenge. Now, same with suffering and trauma. Suffering or pain is a signal that we need to do something about it. And trauma is when we are overwhelmed by it. For example, if we witness something sad, it can come back to us as post-traumatic stress disorder and haunt us in the form of nightmares, in the form of flashback, in the form of internal ruminations going on and on and on. So these are some of the issues that we can see when we reflect on it. Death, for example, may end a life, but not a relationship. Because, for example, I don't want to be confused with my mortal frame, and I don't think I should be confused with the flow of events as I see my life unfolding. An interesting way to look at life is through the lens of flow of information. Basically, the coding in our brain, how we interpret the world, and so on. And sometimes it can be the other way around. A relationship may end. People may mourn the loss of relationship because the COVID crisis has lots of interpersonal violence and other issues. So people may mourn the loss of a relationship while life goes on. And people can be physically absent but psychologically present, or it can be the other way around. People can be psychologically present, psychologically absent, and physically present. And I'm sure all of you have, from your lives, seen examples of both. So this is, I think, a very familiar scene of death. Now, why is this COVID crisis so difficult to handle? And as I was telling you about our brain, uh, basically we like to predict things. I mean, the concept prediction error, from the neuroscience point of view, prediction error, is associated with dopamine surge and learning. But basically, we want to predict what the future will be, and that we really can't do with this COVID crisis. It is a very dynamic situation, and the ground under our feet is shifting all the time. And as human beings, we would like to believe that we have agency, we have control over the situation, and we like the convenience that modern life offers. All these things has been totally ruptured by coronavirus. So, for example, people who were reasonably well off, had good paying jobs, suddenly find themselves being jobless with huge loan to pay. Because obviously EMI was not a problem when they had the job. Nobody has predicted this situation, and it's very difficult for them to handle. It's not just the poor section who has lost their job. The middle class and upper middle class has been in a very difficult situation, and they feel that they don't have any control over their life. Another issue, as human beings, we would like things to be certain, and tolerance of uncertainty is a major factor. This can become pathological. For example, in anxiety, you really insist on sameness. Same if somebody has an obsessive disorder, that things must be perfect. But I think to some extent, this is exploited in our situation as well. People tend to get a whole body scan, whatever that mean, and then they get a battery of blood tests done and they all come out normal, and then they are referred to a psychiatrist. Then they get very upset, they feel that, are we mad? Basically, mental health problems has to be conceptualized using a different framework. I mean, I commonly use the analogy of software and hardware. Hardware is the problem that you can see in, say, SPECT, in PET, in MRI scan, in CT scans. And software is the problem in the networks, and we still don't have the resources to picture what goes wrong with the network, because they're very, very individualized. The role of media in fostering this COVID crisis, the media tends to sensationalize news, exaggerate news. People react in two different ways. They either shut off completely, or they sort of remain hooked to the media. I mean, by media, I mean the print media, social media, television, everything. They are always looking for information to confirm their belief. And the role of the government, again, there are issues here, because sometimes the government tend to downplay the events, often to serve their own benefits. And basically, what has happened, people have lost their trust in all agencies, including the medics, including the scientists, and that's not a very nice thing to happen. As I said, that COVID is an inflection point in the society. The society has been ruptured. And this is the difference between collective pain versus personal pain. Personally, people do have tragedies. I mean, if a family member dies of cancer, say, it's devastating for them. I mean, if a young child loses his parents, that is devastating for the individual. But here, what it seems like is that COVID has not spared anybody. I mean, it's not a personal pain, it's a collective pain. Everybody, in some way or the other, has been affected, and they are mourning it. Be it loss of lives, be it loss of income, be it loss of occupation, be it loss of friends, interacting with friends. So, collectively, we are going through a crisis which has ruptured the society. And both opportunities and risks multiply in such situations. I think we are all too aware of the risks. I will also focus on the positive aspect, like post traumatic growth, and how the society has tried to cope with all these situations by gathering local resources. And I'll discuss that in a minute. As I said, there's no model or template to cope with this. The Plague, this book by Camus, it became the bestseller last year because it's set in the historical background of the plague, and some of the situations are similar to the situations we see now, the lockdowns. I mean, they had military shooting people who didn't obey the lockdown. That is not happening here. Typhoid Mary, again, it's a very strange case of a woman who infected lots of people. But her story, you'll see that it became a conflict between the upper class, basically the scientists and the medics, and the working class. For example, when they tried to get her, to send her to prison, to incarcerate her, the other people of the working class, they shielded her. Obviously, there was these two groups and they didn't trust each other, similar to something which we are seeing now. The people who are working class, they don't trust the medics, they don't trust the doctors, they don't trust the scientists, what they are trying to say. For example, Mary said that I am not ill. Why are you saying that I'm spreading the disease? I'm well. I mean, how can I spread the disease? And she felt that she's being tortured by the society. And similarly, the relationship between coronavirus and climate change is very complicated, to say the least. Probably one has amplified the other. Now, our attitude towards climate change is also very similar to our attitude with COVID, because unless a problem is imminent, unless the problem is visible to us, we don't want to take any steps. For example, we are continuing with our merry way of spending fossil fuels, depleting the resources, and we are not really affected unless the natural calamities, unless they affect us. And even then, we are trying to rationalize that it's not our fault, basically, totally ignore the anthropogenic effect of climate change. People who have seen the Ebola crisis, they have seen similar events, the violence. For example, xenophobia. Here it's always directed at particular groups of people, the minority. They are somehow blamed for it. The interpersonal violence, the stigma that doctors and nurses are facing. Some of the nurses have lost their accommodation. They've been thrown out of their housing. Doctors have not been allowed to enter their residential complexes. So all these things were seen in Ebola as well. Science, as I said, there are issues like mathematical modeling, but people do not understand that. These are concepts which scientists know, like latent period, like infectivity, virulence, etc. But the lay people don't understand these concepts. And of course, they don't understand statistics. It's only stories that stick. So although research is being done, they're not being translated to the people, and often they're coming through the media who have their own agenda. And therefore, the people don't understand the rationale why we have to wear masks, why we have to keep the social distance. And it's a question of personal liberty versus social obligation, the same thing which we saw in the case of Typhoid Mary. She felt that her liberty was being encroached upon, and she did not understand what is her social obligation, because she thought she was well. Why she need to be incarcerated or stop working as a cook? And neither did the working class, whom she represented, understand this. That is why they shielded her from the authorities whenever they tried to catch her. And reality is basic supplies that is being affected. And sometimes scarcity is artificial. People are panicking, they're buying goods, and that is obviously creating scarcity. Finances is a major issue, specifically people who have loans, people who are out of job, and they don't see the future. Misinformation is misguiding people. Lots of people are hesitant to take vaccines, and the stigma, which is affecting the healthcare workers, doctors and nurses to a large extent, because they are bearing the brunt of this crisis. As I said, vaccine hesitancy depends on perceived threat. Lots of people thought that corona was a joke. And unless your family member is affected, unless your house is burning, you don't realize how big an issue it is. And the other thing is, things have to be commensurate. For example, if somebody is ill, it's very difficult to conceptualize that something as simple as a mask can prevent the disease. And similarly, if we look historically, it took 10 years to sink in. For example, if somebody has cholera, the main treatment is ORS, rehydration. That stops kidney failure, dialysis, and all the complications. But understanding that the simple thing ORS, that can stop a deadly consequence like kidney failure, it's very difficult to conceptualize. So unless something is visible, unless something is imminent and people understand the rationale, they are very reluctant to follow people blindly. And the individual reaction can be varied. People can switch off totally, or they start buying. This triggers scarcity. As I said, this stigma, it's always somehow directed towards the other group. And some people get over anxious. I know of people who have died because they were worried that what if they catch COVID? And others are very dismissive. Again, they're going around without masks, and some of them have been admitted to the ICU within 3 days. Conspiracy theories are rife. Who created the virus? Is it natural? Is it artificial? But basically, we have a problem at hand, and that needs to be solved. As I said, different people have different coping styles. Some turn to substance abuse. Some feel there is no point. So they don't do the regular exercises, which is essential for surviving. And avoidance initially gives you a sense of relief, a sense of comfort. It becomes pathological later. So anything that gives you immediate relief, be it substance abuse, be it avoidance, that tends to be a habit. And once it forms a loop, the habit loop, it's very difficult to break out of it. But the positive aspect of it is there had been lots of social support and social cohesion. I will discuss that a little later, how people have positively looked at things. Now, coping with quarantine, basically coping with lockdown, where you cannot go out and mingle with people. In the short term, it causes distress and frustration, whereas in the long term, it can lead to mental health issues. This is actually a picture clicked by one of my friends. Because of the lockdown, obviously, Bengal monitors are now out in the streets. This is an interesting hedgehog's dilemma that can explain the corona crisis. Hedgehogs, in the cold winter, they have two choices. Either they can die of cold, or they can huddle together for warmth. But if they do that, they will hurt each other with their spine. Traditionally, whenever mankind is in crisis, the traditional response is to band together. I mean, we are communal by nature. So, even when we were hunter gatherers, people used to go around together, and especially in times of crisis, the natural reaction is to come close to each other. But in that case, we run the risk of being like the hedgehog, hurting each other with their spines, because a person who has contracted the COVID virus is a threat to others. And if he has not contracted the virus, then he is vulnerable. So the same person can be a threat or he can be vulnerable. This is the psychological stress of social isolation can actually induce brain changes. This was an experiment done in rats. They were isolated for 8 weeks, and this affected their gene expression. The genes responsible for antioxidant effects were affected, and they became vulnerable to oxidative stress, and their neural circuits were damaged. I mean, not all the neural circuits, but the prefrontal cortex, which controls high level thinking, emotion processing, and memory formation. I think lots of people now, because of this prolonged social isolation, are experiencing problems along these lines. There can be emotional numbing, problems with memory, and difficulty in concentrating and solving difficult problems. The role of social support is very, very important. It can be emotional, like love, concern, care, trust. It's important to know that others care for you. It can be tangible, money, goods, services. One thing I was really amazed is that how the society, the community as a whole has come together to combat the crisis. This has happened in local levels. People have cut across political boundaries to help out each other. This is something very, very laudable. Obviously, there is informational support. A group of youngsters, this has come up in BBC as well. They are in the community trying to find resources for people, be it delivering food to people who have COVID or who don't have money, or be it delivering oxygen to them, be it finding beds for them. So both opportunities and risks multiplied. People have come out of their shelves to help each other, and that is a very a positive silver lining that we have got from this COVID crisis. As I said, Informational support, advice, guidance can be important. Companionship, belonging, that is another form of social support which helps people to cope. This is a picture of Sundarban taken after the Yash, and this is one of my friends who went there to deliver AIDS. You can see this line. I mean, it's actually a very devastating experience. But after helping out these people, she felt a sense of achievement, and she has personally grown quite a lot after this. How do we manage the problem? One is adapting to the change. We have to shift from our traditional roles and look at it from the socio-psychological point of view. Listening has always been one of our main skills, and listening to people who are terrified, listening to people who have lost everything can be a very difficult experience. Somehow their experiences needs to be validated and a sense of belonging instilled in them, and ultimately we are hoping that they will become resilient, they will come back from the crisis. And there are lots of embedded resources in the community, some of which I touched upon, and that is the only way forward. As a community, hopefully we can move forward. As I said, to refocus mental health, shift the focus from the patient's illness to take a broader perspective, a sociological perspective, as we say, to meet the patient where they are, empowering the patient so that they can handle the problems rather than being a victim of it. Another issue is social capital. Human capital is the resources we have. For example, somebody who is a driver knows how to drive. That is his human capital, a skill set. A surgeon who knows how to operate has another skill set. Similarly, financial capital is the money we have, whether it's in banks or whether it is in the form of assets. Social capital is the resources that we develop from our connection. I mean, we know somebody in the hospital who will be able to admit the patient. That is social capital. The other issue, as I said, community resilience is a very important factor. After this, I'll enter medical management. I think I've completed the first part of the talk. We'll move on to the next phase then, which is the medical management. So it's the three phases. First is the pre-COVID, before somebody has got the illness, the COVID illness proper, and then post-COVID. I've divided these into three phases because the management of each phase is very, very different. Now, pre-COVID, I think I've largely discussed before, mask and social distancing, the rationale why we should be following it, media and social media, why they should be used in moderation. Because if you read the newspaper, if you don't read the newspaper, you are uninformed. If you read the newspaper, you are misinformed. So we'll have to be very judicious and we have to use our judgment. The attitude is also very important. How do we handle a problem? Attitude towards the healthcare workers, attitude towards ourselves, and this worry, what if I have COVID? We should take some reasonable precautions and then move on with our life rather than ruminating, being a worried well and thinking, what will I do if I have COVID? Because the threat is much more powerful than the actual illness. For example, studies have been done. People who face the threat of unemployment, they committed suicide in larger numbers than people who had actually been unemployed, because the threat is much more of a problem than the actual disease. Some of the things which I did to cope with the quarantine and this isolation was I started writing stories. And this is a story where I was focusing on the use of masks. Actually, it was in response to an article in the newspaper where they were reinforcing the population norm by telling where various people were saying why they don't use masks, because it's hot, because it's uncomfortable, because it's this, because it's that. And in this story, I used humor to induce people to wear masks, because humor can go where reason cannot. COVID psychosis is very, very difficult to treat. It's often fatal and it needs large doses of medications. Uh, I can say almost unthinkable doses of medication. Here, I would like to share the story of one of my patients. This is a man in his 60s who caught the COVID infection, which was undetected. He was treated for normal, because the test came negative. He was treated for normal pneumonia, discharged, and then he came back with florid psychosis. The antibody was positive, the titer was very high, and he was so disturbed. The grammar structure was lost. I mean, one thing is you can't make sense of what the patient is saying, and one thing is the grammar structure being lost. And I've also seen in COVID psychosis, individual words formation is not happening. I mean, they're using new words, neologisms all the time. So basically, to that extent, their language system is affected. Now, what happened with this patient was that I knew that he would die if he doesn't receive a huge dose of medication. Even then, the prospect of living was very low. I wanted to tell the story more to emphasize the power of soft woman in the context. I mean, WHO has been concerned because there had been so much violence against the doctors. I even saw this in the social media today. And this woman, she was a small, quiet woman. She made it a point to meet me every time I visited. This is usually not done. The doctor in charge of the patient, the medical doctor, he usually sees the patient. I report to him that these are my findings, these are my suggestions. But she made it a point to come there every time I visited, even though it was the hours were odd. And I mean, she didn't blame the doctors. She didn't say that you have to do anything. She just spoke in her very quiet voice. The non-verbal message which I got was that I have to do my best for her. There is no fear of retribution. If things doesn't go well, she will be very sad. But that's about it. There's no issue of personal safety. She will not take it out on me in any way. I went beyond my usual role, prescribed a very high dose of medication, some of which were actually contraindicated. And fortunately, he survived. COVID psychosis can be very difficult to treat. And really, I was extremely happy that he survived. And I think the daughter is partially, if not to a large extent, responsible for it. I mean, we do take credits for success, but I honestly believe not just in her case, in all other patients who are well because of my treatment, the patient himself, herself, or the party had played a major role in all such cases. And because COVID often requires steroids, steroid is very well known to cause psychosis. So that amplifies the problem. Obviously, you get something called intensive care unit, ICU psychosis. If patients are in ICU and you see people dying, you know that people die from COVID, and all these tends to make you very, very worried. And besides, there are also ongoing stressors, the financial stress. Obviously, getting admitted usually is very expensive. And this is the story of the father and the daughter that I described. This is a young daughter, but then the tables turned. When the daughter grew up uh, and the father was ill, she repaid her debt. And I was really amazed that I could see humanity in such a beautiful form in the bedside of a hospital. And post-COVID, well, I think I should say that my clinic is virtually post-COVID now. Every patient I see, almost everybody has had COVID, and this has affected their mental health. One group is the ICU survivors, people who had been to the ICU for 2 weeks, 3 weeks, young people who now have kidney failure, diabetes, things they find it very hard to accept. And sometimes it has happened that they have survived, but their family members who were similarly ill, they have died. And in that case, they have survivor guilt that I couldn't do the best for my family members. And this is long haul, the new name, because even if the COVID symptoms are mild, sometimes people get depressed for a very long period after that. The fatigue after COVID is very intractable. Not just fatigue, the arthritis after COVID, the fatigue after COVID, it's often very, very difficult to treat. Uh, and the usual response what we get is people shouting at us over the phone that we are doing everything, we are taking the medicine, we are following your advice. Even then the patient is not getting better. I mean, that is the usual scenario, not the scenario of the girl and well, I shouldn't say a girl, she's a woman now, of the woman and her father. Now, anosmia, when one of my friends described it to it, she was in a safe home. Then I realized how cardinal the sense of smell is. She said that I woke up in the morning, took my coffee, it tasted like hot water. I tried tea, exactly the same. And they came and asked me what I should have for lunch. Should I have fish fingers? Should I have fries? She said, I don't want anything. Just give me a piece of toast. At least I have the sense that I'm crunching something. That's the only sense left. Because fish fingers and dried toast, they make no difference to me. And people who had COVID a year ago, many of them in UK now, they told me they still haven't recovered their sense of smell. And they're hoping that one day they will be able to smell their own perfume. And as I said, fatigue can be crippling. And arthritis, as I mentioned, that is another feature which can be very difficult to handle. Suicide is something which does happen, which people don't want to talk about. I have a friend, actually, he's Dr. Kundu's friend as well, Dr. Kundu's classmate from his school days. He does a postmortem operations, and he felt that in a particular area, in a particular span of time, there were 4 COVID deaths, and the number of unnatural deaths. By unnatural, we mean suicide and homicide, because accidents are very rare in the current scenario, was 21. And he feels that in most cases, unnatural deaths by suicide mainly is overshooting the number of COVID deaths. So yes, this is a concern. This is a major concern, because as doctors, our main target is to save life. And the second target is to reduce morbidity. Economic stress. Just today, I heard about a friend who has killed himself after killing his family members. Reasonably well off, unemployed for 2 years, just cannot cope with the loans. And there's absolute hopelessness. He didn't feel that things would get better. Loans is a recognized cause when people feel they can't cope anymore. This is triggering interpersonal violence. Obviously, when people are not happy, they get angry at the slightest provocation. And interpersonal violence has increased many-fold. And obviously, people, I mean, basically, it's difficult coming to terms with trauma. I mean, reflecting on our past and making sense of our experience, integrating it in our personal narrative and moving on. It's much easier to turn to alcohol, smoking, and drugs. And these are predecessors of suicide, because alcohol basically is slow death. Smoking is probably a little faster because of the cardiac and the pulmonologic side effects. And hopelessness, all pervasive hopelessness. is an important factor for suicide. PTSD is another major complication because if you witness trauma, which many people have, as I said, people with financial resources and social connections have seen their close people die where their resources were of no use at all. They died because they couldn't get beds. They died because didn't have doctors to attend to. They died because they didn't get oxygen. At one point, fortunately, we are over that phase. At one point, the health system was stretched to its limits. It was bursting at the seams. And in post-traumatic stress disorder, people go on re-experiencing the trauma either in the form of dream or in the form of flashbacks. They're hyper vigilant. They're always looking for cues that will remind them of their trauma, and the whole process starts again. Although paradoxical, avoidance and hypervigilance, although these are paradoxical, but they go hand in hand. People tend to avoid the hospital where somebody has died. People tend to avoid the circumstances which was relevant to the trauma. And as I said before, avoidance initially gives you a sense of relief, a sense of comfort, but in the long run, your repertoire becomes very, very narrow. And that is one of the main side effects. Arousal, PTSD is associated with arousal. People are always hypervigilant. Again, paradoxically, there is emotional numbing. They can't experience the normal joys, sorrows, of the ups and downs of life. My personal take on this is I wrote a story about me, my son, and Corona, which I think reflects some of the feelings of people who have their close members in different parts of the country or in different parts of the world. I refuse to end on a negative note. So I will talk about post-traumatic growth, how the corona has taught us to fight, Coney, fight, as I said. So it's a syndemic. It's not just the illness. It's not just the financial issues. So everything taken together, it's a syndemic with lots of pandemics going on simultaneously. Philanthropy, as I told you about my friend who has been helping out people victims of ER. I mean, they went beyond their usual roles. She's basically a counselor, a psychologist. She went beyond her usual roles to help people out, to be an advocate for people, and enormous acts of heroism. And as I said, people, the Red Volunteers, they have helped people cutting across party lines. That is something unheard of in modern times in Bengal, because we always hear about political violence, people of different political groups hurting each other. And people have found new ways of connecting. The elderly people, they have started using Facebook, social media, so that they can keep in touch with other people. And lots of people who didn't have time now is finding the time to write poetry, read poetry, to appreciate art, music, and all this. And I think this is also a fallout of coronavirus, because when the pace of life stopped and we had the time to reflect, some positive contributions did come out of it. I thought I must end with a line from Mahabharata and with a quote from Gita. The first one is from Mahabharata, which says, Matulah jasya Govinda, pita jasya Dhananjaya. Somebody whose uncle is Govind, Sri Krishna, and whose father is Arjuna, the great warrior. I mean, basically, he's talking about people with a lot of social connections and a lot of wealth. So Abhimanyu Rane Hantam Niyati Kena Vadhyate. That Abhimanyu, who enjoyed such social connections, was killed in a war. We really can't do anything to forestall the future. We can't do anything about it. And I really don't want to trivialize the pain of people who had lost their close ones, people who have felt that coronavirus is a great leveler, just like the death. I do not want to trivialize their pain. But even then, I would finish with the last sloka from Gita, where Dhritarashtra is saying, Jatra Yogeshwaro Krishna Jatra Partho Dhanurdhara, where Krishna is the strategist and Arjun is the warrior. Look, they are not father or uncle now. They are now represented by their skills. Tatra hi vijayar bhati dhuvani tirmatir mamu. I'm sure that they would be victorious. I think in the small scale, again, I repeat, I do not want to trivialize the pain of people who have lost close ones. At the small scale, chance events cannot be prevented. We can't do anything about it. But on the bigger scale, if we have the right approach, if we have the right attitude, I mean, if we are informed by the scientists who have done mathematical modeling and who has suggested some courses of action, if we have the correct policy in place, if we have the correct political goodwill at a bigger level, and at a smaller scale, individual resources and community resources, if these can be harnessed properly, then I'm sure that we will be able to beat the coronavirus one day. Thank you very much, Dr. Bhattacharya. Over to you.
Thank you, Dr. Bhargavi. I mean, that was very enlightening. And there were, like pictures of like doom and gloom, which we all are experiencing and, which we hear about, unfortunately, which are beyond our control, how things have panned out. But, like you're ending with essentially sends out a very positive note. So anyone from the audience, if you're listening to us, you can please type in your questions. In the meantime, like I'll start with Dr. Bhargav, like one question that all this lockdown, especially for children, I think, they are a class of people different to us. We can rationalize, we can use logic to understand why this is happening. In their case, it's like, a year ago, they used to go out and suddenly it's like, no, you're not going out. There's no school for you, which is a good news for most kids, including my son. But still, it's like, okay, now this is being replaced by an online class. So do you think for children, this lack of interaction, which is absolutely, like essential for their development as a human being as they grow, how should parents react, or what should parents do?
Well, it's very difficult to accept. It's very tough to accept that basically our life has come to a standstill, and we are losing 2 years of our lives. Again, if I talk about post-traumatic growth, Newton was in isolation for 2 years, and after that he came up with calculus. I mean, class 12 students don't feel that was a good end product of the lockdown, but that is what happened. Online interaction is better than no interaction at all, because health worries are paramount, and obviously because of government directives they can't go out. It's very, very difficult for them. But once we acknowledge that, once we validate their emotions, we have to try to redirect their energy somehow. It's very difficult. For example, I know slightly older than your son probably, but he plays Bengal. He plays cricket for Bengal, and he is refusing to remain cooped in the house. So yes, it's very difficult for them. The only thing you can do is read books to them, try to engage them in other activities. Basically, children take cue from adults. It's a painful learning experience for them, but it's a steep curve. And if they get cues from the parents that yes, they're keeping their cool, they're not involved in interpersonal violence, from that they will learn, and hopefully when things return to normal, they will be able to face the challenge better.
Excellent. Yeah. And this is also the problem with, children being addicted to devices, and so but, like as a parent myself, I think what else is there, in the sense that they can't go out, and there has to be some sort of, correct me if I'm wrong, I think, parents do need to have a certain level of understanding in allowing their children, given the exceptional circumstances, that, okay, it is not perhaps the most ideal thing to do, but this is how we adapt and grow.
The answer is yes and no. Because if we go back to pre-COVID times, I've heard the exact same line of reasoning. The child is not eating, so I'm just giving the smartphone for a few minutes, for a few hours. And then gradually, because the young brain is still forming, the reward circuits and they will be delayed. So it's very costly. I mean, was justifiable to the parent at that point of time as well. The child is crying, so why should I not give the smartphone? The trouble is the child doesn't learn to self-soothe, doesn't learn to look for other avenues. And at the end of the day, the smartphone is a very passive mode of exercise and which is not desirable. There are lots and lots of benefits of social media, of internet particularly. I wouldn't say social media. Blended learning results in better outcomes. But the internet is a tool, it's how you use it. You can use it in bad, very, very bad ways, or you can use it positively. So if somebody is exposed to it at a very early age, that carries a lot of risk. And again, at the risk of sounding judgmental, I can say that basically people, they want the convenience. It's convenient to have a quiet kid, so give him the smart tablet.
Yeah, Dr. Bhargavi, yes, I want to share one of my experiences in my very own family. Like we were speaking regarding children, the same is the case with elderly people as well. Because just a few days back, my mother had been vaccinated, both doses given more than 1 month back, the second dose being given. And one fine morning, she wakes up and suddenly feels that she has contracted COVID. And she was urging me to get her admitted in a hospital just because of the fact that she had gone to the toilet 3 or 4 times overnight. So whatsoever I tried to explain that no, it's not COVID. I had this saturation examined. I had a pulse, BP, temperature examined in front of her, but somehow I could not convince her that no, you have not got COVID. It's just another case of simple diarrhea. So how do you explain that?
I mean, somehow the risk-benefit analysis has to be explained because not every patient with COVID needs admission, and obviously you're aware of the hospital-acquired pneumonias, bed sores, especially with the elderly. I mean, if you get them admitted, it's very difficult to come back to normal. I mean, even if you admit them for a genuine reason. And right now, really patients should not be admitted unless they have to. I mean, it's important to get people admitted when they are really unwell, but it should not be done if somebody's just oxygen saturation dips to say 98 or 96. They're better managed at home. I mean, explain to them clearly that you might lose your mobility. I mean, that is something the elderly are worried about. You might lose your mobility if you have to stay in the hospital, because hospital people think that if I go there, I'll come back well. I mean, it's not. That's a very deductionist approach. That's a very simplistic approach. And same with people who are admitted to coronavirus. Doctors feel that they have need to have agency. They need to show to the people that we are doing something. So they are started on HCQ, was the new kid on the block once, and then it was remdesivir. Although there's not much evidence of remdesivir working, so this is a difficult time. There's no second option but to sit down and to explain to them that this is not the best course of action given the circumstances. And you have to meet the patient where they are. Her perception is if I go to the hospital, everything will be hunky-dory. I mean, it's not as simple as that. And you can actually come back with more problems than you bargained for. So you have to somehow hone it on to and explain it to her.
People with already pre-existing psychological conditions like schizophrenia or bipolar, I mean, is there, and unfortunately, if one of these patients, they're admitted in the ICU, they're battling for their lives, come out of it, what sort of, should they continue with the usual treatment, medications which they have been prescribed, or in your experience, have you seen their condition actually worsen with the current existing?
Yes, because what happens is sometimes people stop the psychiatric medication. That should not be done without consulting a psychiatrist. Yeah, I mean, one of my patients got admitted. Fortunately, the doctor concerned rang me up, and I said that this particular side effect which you are worried about is not a side effect of this medication. And if he stops the medication, these are the likely ramifications to follow within the span of weeks. So fortunately, he was on the medication, and basically he could cope with the problem quite well. In most circumstances, if they are on medication, people can get a crisis anytime. And given these difficult situations, crisis can easily happen. But if people are taking their medication regularly, hopefully things will not go out of control.
There's another new issue of people complaining of insomnia. So, which could be attributed, due to the isolation for 14 days. A lot of things goes around through the mind, the sense of loneliness. And another factor could be that the person is resting now in a room. In the usual circumstances, the person walking around doing some work or the other, a lockdown or not. So, which could lead to like temporary bouts of insomnia. And the problem with people self-medicating themselves with benzodiazepines, because although they are restricted drugs, but you and I, we both know we can go to a chemist shop and no one is going to ask for the registration number, but who get benzodiazepines. So what is your advice for such people who are experiencing insomnia?
It is a major problem. And as I told you before, it existed before the COVID as well. People somehow feel that antidepressants and antipsychotics, they're very serious medications, and sleeping pills are very halka medications. But that is not the case. That is not the case. These should not be taken without medical supervision. Ideally, should not be taken for longer than 3 weeks. And there is just no substitute for sleep hygiene. Basically, cutting down your caffeine intake, that is tea and coffee, cutting down your smoking, because people tend to smoke more when they are tense, and following a regular routine. There's really no, lots of people have taken on gardening. People have been involved in philanthropic work, and somehow, basically 3,000 steps is the basic minimum. If you take that, sleep hygiene, if you follow that rigorously, your need for sleeping pills, and if you accept it, right, I'm not sleeping too well, let's accept that and move on. I'm hoping that you don't need sleeping pills as much as people do these days.
Yeah, so that's a very important message, because people need to understand that it's not a. People perceive it as a short-term solution, that let's start taking sleeping pills, and we can stop it. But they need to understand that once they are on any sort of benzodiazepines or substances like that, it needs to be tapered down. You just can't suddenly stop it one day, and there are consequences, which can be if you stop it suddenly.
Yeah, because I've seen people suffering from epileptic fits, from fits after stopping the medication suddenly. Because sometimes they get admitted to the hospital, and obviously these are supra-physiological doses which they are used to. So obviously they cannot be prescribed, and then they sometimes get fits. Then they have to, we started on anticonvulsants. This has happened.
Right. So I think in the interest of time, we've had a fantastic discussion. We spoke at length on the different aspects, of how we deal with stuff when things go wrong. And I think the only ways that, from what I believe, and I hope you'll agree with me, is keep talking to people, reach out to as many people you can if you face there's a crisis, because the more you keep within yourself, it's going to turn out dangerous. It's like a pressure cooker. So, okay, and we can still hope for a better future. And, the second wave is sort of dying down right now. The numbers are tapering down, but never to lose our guard, because this third wave could strike at a time. So it's one can do best is stay safe, take all the necessary precautions, and indeed get vaccinated, because that's the only way which can take us out from this crisis.
And never let our guards down.
Yeah.
Keep our guard.
Absolutely. So thank you, Dr. Chatterjee. Thank you very much for sharing this wonderful information with us. Thank you, Dr. Shomnath, for being here for us. And thanks to all the people who registered for this webinar. I hope it has been informative. And take care and stay safe. Bye-bye.